Excellent. Okay, so thank you everybody for joining in for this month's webinar. The theme for May has been our joint supplements, and I just wanted to go through some different ingredients, some different research that's out there, a few things that we should do when we're looking at different joint supplements, not only just looking at our own joint supplements, but how to answer questions when people are saying, well, I'm feeding this, how does yours compare? Or do you have anything that's like mine? So we won't, our whole focus won't necessarily be on ours, but how to answer those questions when we're out there and other people have other products that they're wanting us to look at. So this information here has come from a study that was presented at the AAEP, I think back in 2008. So we're now, some years after that. There's probably a little bit more research out there. But as far as glucosamine, at the time of this study, the research suggested that anywhere between 4 and 18 grams per day was useful for supporting cartilage production, improving joint comfort, inhibiting inflammatory mediators. Remember what I always say, inflammation is the beginning to all bad things. Inflammation is what starts the breakdown of the stomach lining, that starts the gastric ulcers. It's the start to the breakdown of cartilage, which causes joint pain and then allows joint disease. There is absolutely research in horses on glucosamine. There are two different types of glucosamine. There is glucosamine sulfate and glucosamine HCl. We have a combination of the two of them in our Optimum Flex product, and they're both very bioavailable. So if somebody says, well, you have to do injections because the oral joint supplements just aren't viable. All of this research has been on oral administration. So 4 to 18 grams of oral administration per day has these benefits in the horse, because we've been able to decrease the molecular size of those particles that we want to investigate, and they are making it to the joint. So how about chondroitin? Chondroitin sulfate, and one of the big changes you will notice is we have porcine listed in the active ingredients next to chondroitin, because at our new manufacturer it is not bovine sourced, it is porcine sourced. So this is good for kind of decreasing some facilities have taken all bovine sourced ingredients away because of the mad cow issue. So anywhere between 1 and 6 grams per day. So what does it do? What does chondroitin do? And you'll notice there's a lot of information on these slides, and as we go through the presentation there is even more information on these slides, because I want you to have this information. I want you to be able to go back and read this information and recall it or go back to it if need be. So it supports the production and slows the breakdown of cartilage, improves joint comfort, inhibits inflammatory mediators. Glucosamine and chondroitin sulfate have been shown in published equine cell research to work together better than they do alone. So another one of the things I always say is I find that our Optimum Flex Plus is a better joint supplement than most, because it has a combination of ingredients. It doesn't just have 1 or 2 of the ingredients. It's not just glucosamine or just chondroitin. It's a combination of ingredients. And the research has shown that these combinations work better, and they all work in different areas of the joint. So some research has specifically looked at glucosamine and chondroitin together, and they work better together than they do individually. Absorption of chondroitin sulfate can be variable, so you have to make sure that you're choosing ingredients that have a small molecular weight, which we do. Our chondroitin is very absorbable in horses. There is a lot of equine research in this area. ASU, or avocado, soybean, unsaponifiables. You say, well, we don't have that now. No, we don't, but I want to show you that just because we're not using it doesn't necessarily mean that somebody else is using that, so it's terrible. There is equine research here. Based on the research, we've chosen to utilize other ingredients in stronger amounts and not just have a small amount of multiple ingredients that you can't put into that 2 to 3 ounce feeding rate. The maintenance dose for Optimum Flex is 1 ounce a day. There is only so much that you can put in 1 ounce. The loading dose is 2 ounces a day. So in 2 ounces, if we know that we have to have at least 1 to 6 grams of chondroitin and 4 to 18 grams of glucosamine, we're running out of room. So there are other ingredients that I feel, based on the research, are a little stronger than the avocado-based ingredient. But what it does is supposed to support cartilage production and slows breakdown by giving some mild anti-inflammatory properties. The combination of glucosamine, chondroitin, and ASU together work better than just the ASU. Hyaluronic acid, we have this in our Optimum Flex, and we also sell it as a standalone product. We recommend 150 milligrams per day based on the majority of studies sitting right around that amount. 100 milligrams per day was used in a study where horses had osteochondrosis dissecans, so a little piece of cartilage had actually flapped off. And the study found less swelling compared to the horses not taking hyaluronic acid after the arthroscopic removal of that OCD lesion. So we recommend 150 milligrams per day. That's based on a wide variety of research. That's the number that seems to be the most effective. Yes, other research has looked at up to 300 milligrams per day, but the results in those studies were no better than the 150 milligrams per day. Omega-3 fatty acids, the DHA. This particular study looked at stride length in horses trotting. And because they were able to improve joint health by decreasing inflammation, slowing the breakdown of cartilage, this study noted a trend towards an increase in stride length for the trot because the horses were less uncomfortable because we decreased the pain. So between 7.5 and 19 grams per day. You look at the feeding rate of DHA per form goes from 9 grams, because the minimum feeding rate is 2 ounces, to 6 grams, which gives you 30 grams a day. 6 ounces, I should say. MSM, we have this in the Optimum Flex Plus. Equine studies used around 8 grams a day, recommended for joint health benefits, some anti-inflammatory properties. Exercised horses given MSM had anti-inflammatory properties because it also has some antioxidant benefits. Now, this is a product that we see down in Texas, is created by a gentleman down there. So some of you up in the northern states may not see this ingredient as much. Cetyl myristalate. It's a little bit hard to say, but anyway, between 5 and 7.5 grams per day, said to have an anti-inflammatory activity, though the mechanism is really not that well evaluated. One particular study looked at lameness scores when horses were taking this cetyl myristalate, and their lameness score improved, and there is a little bit of research there. Again, the research is just not concrete enough, and it only has one activity, and that's the anti-inflammatory property. It doesn't work on joint health or lubricating the joint or anything like that. Yucca and Devil's Claw. Now, there are a wide range of different manufacturers recommending, and that's also because something like Yucca can be as just Yucca, or it can be Yucca Shitagira extract, which we're going to see a lot less quantity in there, and that's why you see between 100 milligrams and 10 grams. That is a very wide feeding rate. There really isn't much any equine research. The research that has been done in other animals and some in humans. But for Yucca, the research in Yucca has been done looking at how it binds ammonia. It's said to have a mild anti-inflammatory activity. The mechanism isn't fully evaluated. We recommend you not give Devil's Claw to pregnant mares, as it can cause uterine contractions, or to give Devil's Claw when you're feeding non-steroidal anti-inflammatory drugs like bute, because we know that bute will wear away that mucus coating, as does Devil's Claw, so increasing our risk for gastric ulcers. So we have the Yucca and the Devil's Claw in the Herbal Respond and the Yucca product. But as you've probably noted, I lean more towards the DHA Perform when I'm talking about anti-inflammatory properties, because I know there's a lot of equine research. That's not to say that the Yucca and the Devil's Claw aren't useful tools to have in your arsenal. They're a little less expensive than the DHA Perform. Anyway. But all joint supplements are not created equal, and many poor quality products are being marketed. A study evaluating human supplements found that only 5 out of 32 products tested met the label claim. That meant they contained the level of active ingredients. In this case, chondroitin sulfate, stated on the label, was just not where it was meant to be. A more recent study published looking at the analysis of equine joint supplements also revealed quality problems. 9 out of 23 glucosamine products failed to meet the label claim, with 4 products having less than 30% of the label amount. That is terrible. But how we overcome that is NASC. NASC. Because NASC has such rigorous quality control testing. They do audits on us all the time. You can ask Jim. We're always getting, audits on all of our products, because they want to make sure that it's not the manufacturers. It's not the DAX or the, Smart Pack, whatever, that are creating these products. We aren't intentionally shorting the amount of glucosamine. So don't look at this and say, oh, wow, these other companies are terrible. They're going to try and short you. But it's where people source their ingredients. A lot of ingredients come from China or Asian countries. We call a lot of these ingredients exotics. Another thing you get with NASC is we have a preferred suppliers list. So in that preferred suppliers list, NASC has not only holds us to task, but it holds all of those suppliers to task. So if they're selling glucosamine or chondroitin to manufacturers that are also NASC partners, they need to make sure that they're selling us a glucosamine product that is what it says it's supposed to be. So that when I formulate these supplements and I say, okay, we need to put X amount of glucosamine in it, because at the 2-ounce feeding rate, I want the horse to get this amount of glucosamine, that when I get that finished product, I can be confident that the amount of glucosamine I want the horse to get is actually in that product. So we've got 2 levels of control coming from NASC. We've got that preferred suppliers list, so we're only buying from known good suppliers. Plus, we have NASC also coming down on us, making sure that the finished product is what we say it is, and that the labels are easy to read and understand. So I cannot say NASC anymore, because this is a big problem. This problem, and it primarily comes up with joint supplements because of where most people source their ingredients, their exotics. I found this when I was doing some research for putting together this webinar. And I thought this was a really neat way of, someone's customer from Ohio is calling me, thinking that I might be able to help them with their horse. But anyway, so a claim, it's an acronym to help us decide whether a particular joint supplement may be good. When we're trying to kind of sift between the brands and we're trying to help our clients decide, they're coming to you and saying, well, I've heard of this other brand. What do you think? And this is how we go through it. A company name you recognize. Joint health supplements made by established companies that offer educational material to both you and veterinarians are a better choice over companies that you're not familiar with and offer no educational information about their products. I really don't know of another company that offers more educational material than DAC does, even out of all of our clients. DAC prides itself on these meetings that we do, and these meetings are not just sales meetings. They are educational meetings. I can't harp onto you enough about how the goal of those meetings is to make sure people are educated on the product. C, look for companies that support safety, showing safety and efficacy of its products or its product ingredients for horses. That clinical experience. We use NASC. Contents. Ingredients should be clearly noted on the label. Again, this is another requirement of NASC to make sure that all of the companies that sport that NASC logo, if you look at every single joint supplement that has a NASC logo on it, you can easily compare between them because the labels are set up exactly the same. We have the percentages or ppms, and then per ounce or the feeding rate, it will give you exactly the amount. So on our Optimum Flex Plus, for example, we don't actually give percentage amounts for the MSM or glucosamine. It's in 1 ounce. It's given exactly how much you're going to get. L, label claims. The product should not include unrealistic claims. Stay away from products using words like cure or prevent, because number one, we're not allowed to write cure or prevent, only if you're a drug, and we're not a drug. Testimonials aren't necessarily a bad thing, but a company with only testimonials and no scientific data to support its claims is less likely to be producing a quality supplement. So then one might say, well, do you do research on all of your products? No, we don't do individual research, but what we do is we source research from all around the world on on the ingredients that we put into the products. So if anybody wants any research on any single ingredient that's in our products, I can supply it to them. So we have scientific data to support our claims. Administration recommendations. Again, it's another requirement of NASC that we clearly state how the product needs to be administered, the supplement. And you should be able to determine how much of each active ingredient you're giving your horse per day. These are requirements of NASC. I, identification of lot and expiration date. And there is always a sticker on the DAC supplement so that you know exactly when it was the expiration date and the lot number, and from the lot number we can work out when it was created. Companies that don't put expiration dates or lot numbers, then how are we ever going to know if that product was 5 years old and has lost its potency? So it's very critical. And manufacturer information. Again, these are all requirements of NASC. Information about the manufacturer should include the name, the address, the phone number, and the website. You should have a way to contact the company if you have any question. So a lot of this information is on the labels. We have the address, we have the phone number, but if you want our website, people can Google us and they can find a lot more information on our website as well. And we get back to people very quickly with any information they want. So the products that we have that we're talking about this month, we've got the Yucca. we've got the Optimum Flex. Let's go back here. Yucca. Yucca, the amount of yucca, 468 milligrams of Yucca Shitagira extract. So the minimum amount, if you go back to the amounts that people have been recommending you use, was between 100 milligrams and 10 grams. And we have about 500 milligrams per ounce of the Yucca 5-way pack. And that you think, well, why is it on the lower end? Because again, we're using the Yucca Shitagira extract, and it's very concentrated. We get this from Alltech. It's very concentrated, so this is why it's very difficult to look at, what other people are doing and compare the actual amount of yucca, because are they using the extract, or are they just using a less concentrated source? And that's where you look at the ingredients. This product also has zinc, manganese, and cobalt. We have a product called CMZ paste, which is zinc, manganese, and cobalt, which is really important for those young growing horses. So zinc, manganese, and cobalt are a huge part of this product as well. Not just the yucca. I know the yucca is what we call it, but the zinc, manganese, and cobalt are a big part of it. Optimum Flex. One of the changes that we have made over time was removing the shark cartilage, because we changed the manufacturer to have better quality control, and the chondroitin sulfate is porcine based. Our manganese, zinc, and copper are also coming from proteinates, 100% chelated minerals in this product. So this is kind of how we talk about the Optimum Flex, the individual ingredients. This is some of the marketing terminology that we have. A source of bioavailable sulfur. Sulfur plays a critical role in the biosynthesis of connective tissue, hormones, and essential amino acids. So scientific research suggests that MSM also has some anti-inflammatory properties, which we saw from that paper that I showed earlier. The glucosamine is required by the body for the synthesis of an important family of macromolecules called glycosaminoglycans, or GAGs. These GAGs make up many body tissues, including tendons, ligaments, and cartilage. So now you can see we're starting to affect more parts of the joint. The lack of glucosamine in the joints may lead to specific tissue weakness. As tissues in the joints become damaged, the lubricating synovial fluid in the joint spaces becomes thin and watery. Therefore, the normal cushioning effect of the joint is lost, leaving the bones and the cartilage to grind against each other, leading to pain and inflammation. So that then leads to joint disease, osteoarthritis. Chondroitin sulfate is another one of those GAGs that provides structural components to the articular cartilage and provides nutrition to that cartilage. So now we're building on that joint. Vitamin C also is an antioxidant believed to reduce inflammation, pain, because it's a very potent antioxidant. Now, vitamin C is not an essential nutrient to the horse. The horse makes its own vitamin C, but we do know in cases of joint pain that it can be beneficial. Hyaluronic acid, or sodium hyaluronate. It's another one of those GAGs that provides structural components to the synovial fluid, which provides that lubrication and feeds the joint tissue. So it's very important. Manganese. It's a trace mineral that's found mostly in bones, the liver, kidneys, and the pancreas. Manganese helps in the formation of connective tissue and bones and blood clotting factors. It also plays a role in fat and carbohydrate metabolism and calcium absorption. Manganese is also necessary for normal brain and nerve function. Low levels of manganese can contribute to bone malformation and weakness. So that's one of the kind of minerals that we have in. Zinc constitutes a structural element of this alkaline phosphatase, ALP. 4 of the atoms that are present in this ALP come from zinc. So these osteoblasts make up bone. Osteoblasts and osteoclasts make up bone. And the ALP is really critical for developing these osteoblasts that make bone. So that's why the zinc is really important for that bone mineralization. A shortage of zinc can also impair growth and repair of tissues, connective tissue. We need zinc for the collagen that makes up bone and cartilage. It's also important with calcium and phosphorus. The High Victory. It's got a high concentration of the sodium hyaluronate. So at 2 scoops a day, you're getting 250 milligrams a day. Herbal Respond has our devil's claw, which we don't want to feed to pregnant mares, and it's also on the banned substance list. So I use a little more sparingly, and I don't recommend it as much as the DHA or the Optimum Flex, just because we know there are certain performance horse groups that can't use this product unless they have a really good handle on the withdrawal time of this product prior to exercise, but it kind of defeats the purpose. Proprietary blend of some different herbs. Turmeric is known to have, and again, none of these have equine research, but the research in humans shows that these herbs can have some anti-inflammatory properties, as does the Yucca shidagira and the devil's claw extract and the boswellia. The DHA Perform, now I know this month wasn't necessarily focusing on the DHA, but I cannot go past to when we're talking about joints and not talk about DHA, because it's such a potent anti-inflammatory and there is so much equine research. We've seen this over and over again. I'll keep showing it to you because I still have people say, well, I feed flax. It doesn't matter. Flax gives you ALA. That does nothing in the horse's body. That needs to be converted to DHA and EPA, and in the horse's body, that conversion is less than 1%. This crazy chart here is really just to show you inflammation. This is an inflammatory pathway in the horse. Do you see ALA written anywhere on this slide? No, because ALA has no role in decreasing inflammation in the body, in your body, your dog's body, or your horse's body. It's the EPA and the DHA that come into this pathway to decrease inflammation. Your other products that also supply omega-3s, and whether they're actually supplying DHA or not. I know you've seen this before, you've got this before, but it was just another rehash. Look at all that research, and there's so much more. So, if we lay them all out, Optimum Flex Plus, blend of chondroitin, glucosamine, HA, MSM, and vitamin C, and some minerals to support joint health and alleviate inflammation. It's kind of touches on all parts of the joint. If we know that we've got an older horse that has been exercising a lot, and we know that it's at that age most likely got some joint deterioration, then that's where we're going. High Victory. We have a lot of racehorse people that want to just add extra hyaluronic acid to increase that synovial fluid. The DHA Perform. This is always my go-to first. I go to first because we know that it will alleviate inflammation. So if you've got young horses and you're like, we're starting them, maybe we want to just make sure we decrease inflammation, we're going to go with DHA or the Yucca or the Herbal Respond, because if we can decrease the inflammation, we slow down the progression of that joint disease. Now, obviously, if we're competing these horses, be careful with the Herbal Respond. The Yucca if you're feeding large quantities of CMZ already and then you add the yucca, then we're going to get a lot of that copper, manganese, and zinc and cobalt. So I would be cautious if I was feeding cult grower large quantities of CMZ paste and then adding a lot of yucca on top of it. I would be going more towards the DHA Perform, because just because copper, manganese, and zinc and cobalt are good for joint health doesn't mean that excessive amounts of them will be better. So I saw on one of our message boards the other day about comparisons, and had I done a certain comparison. These are the comparisons that I've done over the years between different joint supplements. And I've got them here, and on a couple of them I've got some pricing, and the pricing may be completely wrong because they're older. Our pricing might be wrong. Their pricing, if you go to their website, may be wrong, but it gives you at least a place to start. So looking at the manganese, the Optimum Flex Plus per ounce, 8,500 milligrams of MSM, it's 4,000 glucosamine, 1,000 chondroitin, 250 of vitamin C, 150 of hyaluronic acid. You can read all the way down. The Myristolate, or the Myristal Equine, that's really sold mostly out of Texas, has some other ingredients in it, very limited amounts of the, no, so it's only got half the amount of glucosamine, no chondroitin. It's got a small amount of MSM, and it's putting all of its eggs in the Myristolate basket here. So I don't feel like it's really touching on as much of the all of the different parts of the joint. Optimum Flex Plus compared to a Smart Pack product, the Smart Flex 2 Support Pellet MSM, they've got more MSM, more glucosamine, same amount of chondroitin, a lot of vitamin C, no hyaluronic acid or minerals. The other part of this product is it was quite expensive. Now, I know we're going to be talking about Total Performance next month, the Total Performance Plus, but I figured I would throw it in here because people asked me about Platinum Performance, CJ, and the Total Performance Plus must be fed at your 3 to 4 ounces a day in order to get the maintenance dose of Optimum Flex. Someone recently asked me whether their client should switch to just Total Performance and add Optimum Flex, and it all depends on how much Total Performance you're feeding and whether you want the maintenance or the loading dose of Optimum Flex. So if you're feeding 2 ounces of Total Performance, then you're not getting the maintenance dose of Optimum Flex. If you're feeding 3 to 4 ounces of Total Performance Plus, then you are getting at least the maintenance dose. You guys can follow this all the way through. I think the bottom part here is what stands out the most to me. It's $5 a day to feed the Platinum Performance CJ. And as far as joint protection, I just don't think it cuts the mustard for the price. Optimum Flex Plus compared to ActiFlex powder. And you all can read these yourself. That's what I have today. Unmute yourselves if you want to ask a question. Okay, so I am now going to go back and read the questions here. Oh, wow. Okay. We have, by feeding a joint supplement, can it help the horse make its own synovial fluid? Yeah, if you're feeding hyaluronic acid, it's going to help. It's going to go into that joint and it's going to build up that synovial fluid if you keep a healthy joint. Now, my one caution about feeding a lot of joint supplement to that young horse where you feel like you're just, wanting to avoid joint disease is that once you start feeding it, the horse stops producing as much of its own, and so you can't really take it off it. So that's why I always start out with the DHA Perform and then over time build up. That's the follow-up to that question. By feeding a joint supplement, can it help horses? No, you've already asked that question twice. Client using Herbal Respond and Optimum Flex and has seen great improvement in the horse's comfort level. However, horse may go back out on the show circuit. Would you recommend the DHA or the High Victory as a replacement to wean off the Herbal Respond due to testing? I would say go to the DHA. And I would switch the horse off the Herbal Respond and onto the DHA Perform instead of the High Victory. Okay, no one else has any more questions. You can unmute yourself and ask a verbal question if you don't want to type.
I have a question related not to joints.
Sure.
Had a client ask me about roasted oats.
Roasting oats.
Yeah, not crimping, not whole oats, roasted oats.
Yes.
What's the nutrition value of it versus whole oats versus crimped oats?
I would imagine it's a complete waste of time based on the information I've seen on other roasted grains. It's just charging customers more money for a weird technology that's not useful.
Okay.
Other questions? Otherwise, we're going to sign off.
Okay. I have a client that has a 28-year-old gelding, and he's no longer rideable for other reasons. He was a rescue. He had broken his back 3 times, has hip injuries. They found out that he broke his sinus cavity. He is on the Yucca right now.
Mm-hmm.
And is that good enough for him as long as he is still
depends.
maintaining it?
Do the people feel like the horse has been responding well? Do they feel like he's comfortable? If yes, then it's totally fine. But if they feel like they want to step up the next level, go to the DHA Perform. And, if money's never an option, never an issue, which it always is, I'd be adding the Optimum Flex Plus in as well. But if the Yucca is they're feeding it and they feel like he's comfortable, then leave well enough alone.
Okay. Thank you.
No problem. Another question here. Would I use DHA in place of Opti if giving injections? I don't really know what you're asking there. They're 2 different products, and we will, if the horse is getting joint injections now and it's a horse that we know has joint degeneration, then Optimum Flex Plus. If they're just giving maintenance joint injections because they've got more money than they know what they do with, and they feel like they're going to avoid joint disease by giving them injections, then again, we go back to that's the place for DHA. Okay. If we have no more questions, what is salicylin? I have no idea. I'll look it up. Somebody's asked. Client using black oil sunflower seeds instead of oil. Look at the concentration of fat that's in a black oil sunflower seed compared to oil. Oil is 99% fat. Black oil sunflower seeds, just like rice bran or anything else, work out to be about 25 to 30% fat. So my go-to is always oil because the black oil sunflower seeds just aren't as potent as the oil. Can you feed DHA and Optimum Flex Plus together? Absolutely, you can. And that's it. No more questions. For the young horse just getting started, do you recommend colt grower and DHA together? Yeah, that'd be a great idea. Absolutely, because especially when you're starting a young horse, you're putting a lot of stress on them. And so the colt grower and the DHA would be great. And maybe you don't want to keep them on the DHA. Maybe their finances don't say, oh, we can keep them on the DHA all the time. But just when you're really starting them, stressing them, doing a lot of more of that exercise, and then when it's just kind of slowing down, tapering off, you could taper off the DHA. But definitely when we're doing that early stress work. Okay, I'm going to stop the recording. And I appreciate you all signing in today. Look forward to talking to you next month when we will talk about Total Performance and Total Performance Plus.